Hello, this is Dr. Kate with the Form, Function, and Flow Lab podcast. I am on vacation, so I am filming from my room. You can see people everywhere, very loud, so this is the quietest spot I could find. I wanted to do today's episode on a little follow-up on last week's with my own health journey with how medicine is many shades of gray and not just black and white. So if you listened to the episode before, I was having some thyroid issues, a little mass on the left side, and PCP missed it. I asked the nurse midwife for my yearly visit to check it out, and she had me do an ultrasound, showed some questionable stuff, got a biopsy, also showed some questionable stuff, had molecular testing, definitely showed some questionable stuff. So I went back to my PCP, had him check it again so that he, knew what he missed. And we chatted about, what he would recommend, where to go, those kind of things. So essentially you go to an ENT because it needs removed, at least half of it. Now some people would choose to take out the whole thing. So there's that shades of gray. When you take out your entire thyroid, then you have to be on medication for life because you need Synthroid or levothyroxine to help totally replace what you're missing from your thyroid. That's not something that I was interested in. I've never been on medications, and I've had lots of patients in my office that have been on Synthroid that still struggle with managing that, with fatigue, with weight gain, all sorts of things. And I wanted to be able to save part of my thyroid if possible, to hope that it would produce some of the stuff that it needs to. So when I was seeing the PCP, he kind of was leaning towards, if it were him, he would take out the whole thing. And that's not kind of how I would go with it. And I went to 2 ENTs, got 2 separate opinions, and I actually called an old patient that was an ENT, retired, got her take on it. And pretty much the consensus from the ENT side of things was they gave me that option to take out the whole thing, but sort of recommended, since I'm younger, to take out half. And another thing that you have to do when you are taking out half a thyroid or a whole thyroid is they try to keep the parathyroids. They take them off and they put them back in, and those regulate your calcium in your body. So if they don't end up working, you also have that issue to manage as well. So everybody has, again, that different way that they go about attacking a problem. It's not black and white. And especially just from what I've seen in my office with how people respond or don't respond well to Synthroid, I really wanted to try and keep as much functioning thyroid as I could, especially since my thyroid panel levels are actually pretty good right now. So that is what I'll be doing, and if they take out half and it does end up being cancerous, then we'll have to go in maybe and take out the other half, maybe do some radioactive treatment to help clear up everything else. It's a pretty easy recovery, and I don't think it should be a huge thing, but I'm glad that I pushed a little bit and had the ultrasound done, because who knows what I would have gone back to the PCP, had them check it again, and how much bigger would it have gotten before somebody actually did something. And I don't know how fast growing it is or anything like that, but just a reminder to be a little bit pushy, a lot of bit proactive for your own health, because you know your body better than anybody else. And this doesn't just go for, thyroids or PCP visits, but it also goes for like your pelvic floor. If you go to your PCP or OBGYN and tell them that you're having leaking or pain with sex, and let's say with the pain with sex they just tell you to use lubricant, give it some time, that might not be your best option, and you'll want to work on relaxation techniques and trigger point work and all sorts of things to help you get there faster and easier with some really not intrusive interventions. And then with pelvic floor issues, one example that comes to mind is a lot of times doing pelvic floor therapy and external work works great for these issues. However, if you have a really severe tear from childbirth and you actually tear the levator ani muscles, that's something that you want to push to get addressed, because if they can go in and surgically reattach them and fix them, you're going to have much better function of those muscles if you get them reattached right away. That's not something you want to wait on. So you don't want to just be pushed to the side and told that it's normal and told to just deal with it. It's something that everybody deals with. That's when you want to get pushy, especially if you know you've had a 3rd degree tear or 4th degree tear, to get that assessed and see, does this need surgically fixed so that I can regain as much function as possible. A lot of times, again, if it's not torn that badly, you can have lots of good results without, but if it is, you definitely might be a candidate. And if you wait too long, it might not be an option anymore to get it repaired. So again, you know your body better than anyone, and you really need to push for getting that assessed. And moving away from pelvic floor issues, the same goes for imaging for when you have just straight up musculoskeletal issues. And a lot of times the hang up for people are their insurance companies. For some reason, we have this weird system of hoops that we have to make people go through if they're having pain down their leg. Radicular pain is what we, sometimes term, stuff like that. Or if I do orthopedic tests on you and I think you have a herniated disc, I can't just have you go get an MRI. And that is what shows us if you have that or not. A lot of times insurance companies make you go through the soup of getting an x-ray first, and then they'll drag their feet because they don't want to pay for an MRI. And I think it's almost like they try to make it so that it's as difficult as possible, and they want to deter the people that are like, oh, they don't want to sign off on it. It must not be that bad. That is not true. They just have this weird rubric that they make you go through. They're not looking at you as an individual person with individual symptoms. There is no magic portal where we say this person has A, B, and C in your billing system. So you really sometimes have to actively jump through those hoops, push a little bit, call them yourselves. A lot of times they want to hear from you yourself. So this is my spiel, these last 2 episodes, that you really need to advocate for yourself, get second opinions, even if it's something minor. My surgery is going to be pretty routine, and the lady that I picked to do it has done 4,000 of them. It's not a scary surgery, but I still had a second opinion, a third opinion if you count the patient I talked to that's retired, because you never know. And I always try to, I know it's a pain and people don't like to do that. They just want to get it done. But I think it really doesn't hurt and can sometimes really help you in the long run. So this is my very short follow-up to last week's medicine is not black and white. It is many shades of gray. If you have any questions about your own stuff that you're going through, reach out to your PCP, try to get them to explain more to you. I always, even if I'm not the one ordering imaging for a patient, I try to make sure that I can go over it with them, because it helps to break things down into verbiage that makes sense to them and lets them visualize what the issue is that they have. So have a great week.